you were telling me about the young boy that you did, is that who you just did, the one that cut the tendons?
Oh, tonight, yeah. So tonight I had my last patient, which is why I'm dressed inappropriately for the show, is a fellow who, my recall is that he's home helping dad who runs a window business, a very reputable window business, but unfortunately the window pane was wet and his glove slipped and it went through the glove, a big sheet of glass, and cut his flexor tendon. So flexor tendons are the tendons that help you make a fist. And so he couldn't bend his last two fingers at all. And so we have to expose the tendons and sew them together, and then a much longer, much more important therapy process takes place.
Do they normally go back for the most part? I mean, they'll heal and
Right.
You'll use them again? You have some limitations, I'm sure.
Sometimes I've had two tendons repaired, and I have no dysfunction, but. Yeah, it's possible that you have some limitations in motion.
Sure.
It depends on it's more of it's more adversely affected by two issues. If it's a really horrible trauma, for example, the glass cut you several times, or if it's a crushing injury, those type of things are tough to get a normal outcome out of. But the thing that affects the outcome more than anything is compliance, patient compliance. And that doesn't mean that they're always being a bad person. Sometimes people just can't deal with pain. I myself am the biggest wimp I've ever met. But some people can't deal with pain. Some people can't afford their pain medicine. Some people can't afford the therapy, and that adversely it creates an outcome. You know, so I look at it, and what I tell patients is, you do 30% of the work, I do 30% of the work, and the therapist or your therapy cooperation does 30% of the work. If I do a great job and the therapist does a great job and you don't, whether it's something that's your fault because you're a slug and you don't participate in the process, or it is because you can't afford the therapy or something that's, understandable, then your outcome is much less. If I give you my 33% and you give me your 33%, but the therapist doesn't do their job,
Right.
then that's a 66, and that's a failure in every great book. Right?
That's right.
So all of us have to meet and satisfy our one-third requirement for a great outcome to occur. And unfortunately, that's not always doable, and it's nobody's fault, but it's not always achievable. So you work around it.